Okay, so you guys know what California looks like. That's the Bay Area. That's San Francisco. That's Alameda County. A lot of people don't know what Alameda County is. Huge. It's not only huge, it's shaped like a boot that's about to crush San Francisco. And there are times when we were very tempted to so do. But I show you this for a reason, because the boot pattern you're going to have to track in the next slides that come up, which are a series of maps. And so down in the toe, you have Oakland and Berkeley. Down towards the heel, you have sort of the 80-80 suburbs that sort of blossomed in the 70s. And then up the laces, you have basically the 580 corridor going out to Pleasanton and Dublin, blossomed in the 80s. And then down at the top of the boot here, you have this weird mixture of nuclear bomb makers and goats. Literally. Okay, so we took all the services we provided in the public health department, and this is in fiscal year 05-06, and wherever we had an address to a family, we put a dot on a map. And that's what these are. These are pediatric services provided by the public health department. These are infectious disease services. These are chronic disease services like asthma and the like. These are perinatal services to moms and babies. These are WIC, Women, Infant, Children Nutrition Services. Took all those services, put them in the numerator, and in the denominator we put the population of the underlying city. So you see it's just a crude per capita measure of services. So the city of Oakland, which is in dark brown there, has a high per capita consumption of services, as does the city of Hayward. And the city of San Leandro and the unincorporated areas in between Hayward and Oakland are some of the highest service consumption areas in Alameda County. Okay, so not that surprising. We went down beyond the city level down to the neighborhood level, and you see here West Oakland, parts of the Oakland Flatlands, East Oakland, parts of the unincorporated area, parts of the city of Hayward, high service consumption on a per capita basis. If you asked our nurses that are out in the field, they would say, yeah, so what? You know, big deal. What do you think, you're a rocket scientist? So we went to our friends at the social service department and had a budget 4 times as big as ours, and these are Medi-Cal recipients. These are food stamp clients, CalWorks, general assistants, did the same analysis, found West Oakland, parts of the Flatlands, East Oakland, parts of the unincorporated area, parts of the city of Hayward were their highest service intensity areas. This is the CalWorks distribution. This is food stamp distribution, general assistance, Medi-Cal, and then this is the whole population of social service recipients in Alameda County. We went to the probation department, did the same thing, found West Oakland, parts of the Flatlands, East Oakland, parts of the unincorporated area, parts of Hayward, this weird little thing up in North Berkeley, which is actually a juvenile detention facility up in the hills. It's a group home, so it's kind of an artifact. And then went to the state and got the parolee data and get about 6,000 parolees coming back to Alameda County every year. Same analysis, West Oakland, Flatlands, East Oakland, parts of the unincorporated area, parts of the city of Hayward. These are the top 30 census tracts receiving public health department services, the top 30 census tracts receiving social services, the top 30 census tracts receiving probation services, the top 30 census tracts receiving parole services. 15 of those tracts overlap. Combined spending in those 15 neighborhoods in one fiscal year, and this is 2005-2006, it's on the order of $300 million. So real money spent in these 15 neighborhoods. Important for us to understand a little about these neighborhoods, wouldn't you think? What about these neighborhoods is driving this demand for services in public health, social services, parole, probation? And keep in mind, all of these services are services provided to individuals or individual families. Also keep in mind that this analysis had never before been done, despite hundreds of millions of dollars of expenditures. And I think that that's a real failure of critical thinking on the part of government. And that we can do better. We can do better than that. We're smarter than that. We now have very good tools to do this analysis, and it allows us to think about what we're doing rather than just robotically going ahead and doing what we've always done. Okay, so we generated a hypothesis that is that place matters in health. And it sort of takes the medical model and it starts to question this: is there something that drives perhaps these risk behaviors? Is there something perhaps in neighborhoods that can make people more likely to smoke or to drink or to engage in risky behaviors, drive without a seatbelt? So we wanted to look at the physical environment in neighborhoods. We wanted to look at the social environment. We wanted to look at how segregated they are racially, income segregation, which is a big issue in the Bay Area. In 1993, there was this sort of one of the fathers of public health, this guy, Bill Fahey, who was the architect of the worldwide smallpox eradication campaign. In 1993, he published this seminal article in the Journal of the American Medical Association in which he said, we ought to stop talking about diseases. It doesn't make sense to talk about diseases because diseases are driven by these actual causes. And we ought to start exploring these actual causes and developing a practice that addresses these actual causes. And he defined the actual causes as four, one being biology, or genes, if you will, and he ascribed 20% of the causality to biology. Healthcare, he gave a paltry 10%. The environment, which he defined fairly narrowly, like water, air, and the like, is 20%. And then behaviors, what people do to themselves, as being the bulk of the actual causes of death. Since that time, we've recognized that this notion of a rigid barrier between nature and nurture, or biology and environment, is false. There's very well documented evidence that the phenomenon of epigenetics occurs. Epigenetics is basically, very simply put, if you take two identical twins and put them in radically different environments, that their genes would actually express themselves differently. And so nature influences nurture, influences nature. There's no rigid barrier there. So environment can shape how your biology expresses itself. Our hypothesis also looks at this question of, can the environment shape your behaviors? And if so, then we need to not just look at the behaviors. We actually have to look at the environment and those aspects of it over which we have some control. Okay, so the hardest people to talk to about this are doctors. Why? Because we were trained in an environment where we were taught to essentially block out the outside world and to think about the body as a collection of organ systems and to think about those organ systems being linked together by this beautiful physiology. And nothing else mattered. It's the way blood flows, it's the way chemicals are processed in the body. That's what medicine is. And it reduces essentially human life to a collection of organ systems. Now, so doctors think about the environment and they think that's irrelevant. But there's very good evidence now that the environment changes human physiology. And it operates through, for lack of a simpler concept, it's the notion of chronic stress. Chronic stress can actually get under the skin and change your physiology. And so the concept of the allostatic load is that there are stressors in the environment, which we all recognize. It may be long commutes, it may be unaffordable housing, social isolation, crime, job instability, or high demand, low control jobs. All of those things can essentially conspire on humans to make them stressed. And when they get stressed, that stress can change your physiology. How does that happen? Very simply, the body interprets the stressor through the brain, through an organ called the hypothalamus, which sends a signal to another part of the brain called the pituitary gland, which sends a signal to the adrenal glands, which release a number of hormones, of which cortisol is a major actor. Cortisol is a stress hormone. Cortisol is a good thing to have flowing through your blood when you're stressed. It's a bad thing to have flowing through your blood over time. So if that stress continues and is not mitigated by some sort of solution, that cortisol downregulates your immune system and generally causes premature wear and tear on your body's organ systems. And that's bad for us. Cortisol actually causes premature aging, chronic cortisol exposure. And so, very simply, we have a mechanism by which the environment, through stressors, can actually change the body's physiology. Now, stress, we all have stress in our lives. And stress isn't necessarily a bad thing. Stress, when you have resources to deal with that stress, is really just a challenge. And the ability to actually apply your resources to the stressor is something that can be very fulfilling for people. But if you've got stress and you don't have resources, then stress basically just stays with you. And that stress cumulatively over time can drive physiologic changes in your body. And that's been well demonstrated actually in several different models. There's actually now a large experiment going on under the auspices of some Harvard researchers looking at cortisol measurements in different strata of the population over time to try to correlate this actually in a human model. Okay, I remember I told you about death certificates being able to plot life expectancy over time. The other thing you can do with death certificates is you can actually map death. And this was one of the most powerful things that we did because it led us to be able to say, give me your address and I'll tell you how long you will live. And the sad truth is that in America, you can do that. And you can do it pretty easily. And you will be right much more often than you're wrong. And you shouldn't be able to do that. The fact that you can do it says more about our policies and the way we've structured opportunity in the society than anything about human physiology. This is Alameda County, again the boot, and you see in West Oakland, parts of West Berkeley, the flatlands, East Oakland, unincorporated area, and some sprinkles all the way down into Fremont. People are dying prematurely. And they're dying on the order of 10 to 15 years before other people in Alameda County. And the other thing is that people living in these yellow areas, the quote-unquote middle class, pay a price in life for being middle class. Same thing in Seattle, King County. You also see it in Baltimore, Maryland, where I went to medical school, where they have a neighborhood here with a life expectancy of 62.5 years. That's the average age at which people die. Then in another neighborhood here with 82.9 years. This is Los Angeles, which published this actually fairly recently. It was in the Los Angeles Times about a month ago. This is Cleveland, where I've had the privilege of working, where they have the distinction of having the biggest gap in life expectancies between census tracts that we've seen. Almost 25 years between these two neighborhoods. Let me just say that again. 25 years of life difference. And it's, literally just a few minutes up the street. There's nothing natural about that. That's social policy. And so if we're going to address these things, we have to understand the impact of social policy on human health. And we have to come up with strategies that make sense. There's no brochure for this, other than move the hell out of Huff. This is the Bay Area, which we did several years ago in the Barhigh report. So I wanted to show some Marin County data. Unfortunately, Marin has a small population, so it's hard sometimes to show these pockets. But I'll show you some data in a minute about Marin, which suggests that there are. So back to Alameda County now. This is the map of poverty in Alameda County. And people are like, well, why'd you wait so long to show me this slide? I knew that was sort of the driver. Well, you were right, sort of. West Oakland, parts of the flatlands, East Oakland, parts of the unincorporated area, parts of the city of Hayward have high levels of poverty. You see this spot up in North Berkeley, which is really just students who aren't really poor. They're just acting poor. So we're not really that worried about them. But this is on a census tract platform, of which there are about 150 at Alameda County. You can take the life expectancy map, which is also on a census tract platform, and you can correlate them. For every census tract, you have a life expectancy and you have a poverty rate. So you can do simple math, a bivariate correlation, put life expectancy on one axis and poverty on the other axis, and you see this relationship. And that is, as neighborhoods become poorer, life becomes shorter. This is the cost of being poor measured in death. This is the true poverty tax. This is what poor people pay in terms of the length of their lives in Alameda County.